All right, so I know that you're here to learn about the winter blues and how to manage it. But before we do that, I just wanted to share with you this new little shrink that I got from my neighbor Totoro. I think it's pretty cool. So hopefully you also think so, and maybe it also helped boost your mood by about 2%. But let's get on with the video. Okay, so I think this video is probably going to be published sometime late October, early November. So I think this is a good time to talk about the winter blues, otherwise known as seasonal affective disorder, because a lot of people do start to struggle with low mood, especially as we move into the winter months. And this is a very common phenomenon. In fact, a study in 2009 by Bang Newson looked at all the epidemiological studies and found that the sort of prevalence rates for a seasonal affective disorder, we'll just call it SAD for short, was somewhere between 1 to 10%. And I suspect one of the reasons for this considerable variability in prevalence rates is that it depends on the region that you live in. So places near the equator, where maybe the seasons are all kind of similar, then it's going to be much less impactful on overall mood compared to if you lived in sort of the northern regions where all of a sudden during the winter, it's like dark at 4 p.m. and you're not getting a lot of sunlight, and when you wake up it's also dark. So in that context, the impact of seasons on mood is going to be significantly higher. So in this video, I'm going to talk about some of the main symptoms of seasonal affective disorder, what you can look out for, as well as some of the strategies to manage it if you are someone who notices that they feel a little bit more blue, a little bit more down, especially come fall and winter. If you don't know me, hi, my name is Dr. Parky. I'm a clinical psychologist licensed in the state of California and now also in Ontario, Canada. I love talking about all things mental health, especially the things that are evidence-based, and I'm here to share some of that information with you. So let's start by talking about how do we make a diagnosis of seasonal affective disorder. So in the DSM-5, there's actually not a specific disorder for seasonal affective disorder, but what there is in the major depressive disorder category, there's a specific specifier where you can put with seasonal patterns. So essentially what you need to sort of be diagnosed with seasonal affective disorder is that you need to meet criteria for a major depressive episode, and then also have that be cyclical with kind of like the changes in the season. So normally you notice this reduction in mood in the fall and winter season, and then as you move into spring and summer, you start to feel better, and that seems to happen on a fairly reoccurring basis. Okay, so how do we manage it? So usually I like to choose strategies based off what I think fundamentally leads to the disorder in the first place, which makes perfect sense. Like if we're thinking about seasonal affective disorder, what are the sort of components that are changed, the variables that are changed that might be contributing to low mood? And some of the things that I can think of would be the reduction in light exposure, as well as potential reduction in positive reinforcing activities because we're kind of cooped up in our home all day. So one of the more obvious suggestions then would be to, of course, get a little bit more light exposure into your day-to-day. And your immediate response might be, well, that makes good sense and all, but I don't have any light exposure. The sun's not up at 7 a.m. when I wake up for work. And the answer to that is to get something called a light box. And a light box is basically exactly what it suggests. It's kind of like a box that shoots light at you, and it's supposed to mimic the functions of the sun. Usually, if you're picking out a light box, you want it to be at least 10,000 lux, which is kind of a unit for lights. And you want the light box to be, maybe a feet or two away from you, and it's in a 45-degree angle, so it's kind of shooting you light at an angle for about 30 minutes. So this practice will be really helpful to set your circadian rhythm and give you a little bit of that mood boosting experience from the light exposure. And for which light box you should choose, you can kind of pick whatever one feels right for you, as long as it's at least kind of the minimum effective dose, probably somewhere around 10,000 lux. So alongside light exposure, the other thing that's kind of important is this reduction in positive reinforcing activities in our day-to-day. And what I mean by that is that when it's cold out, when it's dark at like 4 p.m., we're not able to do all the things that we normally would have done in the past. We're not maybe going hiking as much as before, spending time with friends as much as before, or even going outside in general and walking, along the park. All those things seem to kind of go by the wayside because it's too cold and it's too dark. And unsurprisingly, when we reduce these sort of activities in our day-to-day, our mood is naturally going to reduce. And it's actually a common symptom of depression where it becomes a vicious cycle where we stop doing all the things that we like and we feel worse. And then as a result, we feel worse. So we don't get as much enjoyment when we do those things. And it becomes this sort of negative cycle and moves us more and more towards depression. So one thing that can be helpful is to plan out some activities that you can do even in the dead of winter. Like, can you still maybe give yourself that really nice hot bath? Can you still get your favorite coffee drink? Can you still maybe have virtual sessions with your friends and have a virtual game night? What are some things that you can do in spite of the fact that it's hard to go out, it's cold, so you don't want to go out? All those things can act as barriers, but what can you do in spite of those barriers? And by engaging in these meaningful and fun activities, we can also start to target some of the unhelpful cognitions or thoughts that can perpetuate depression. And you can imagine that for some people, especially in winter, they might have sort of more depressogenic thoughts like, oh, I can never do anything during the winter. It's hopeless. Things are so crappy during that time. I can't do anything fun. And you can imagine how these thoughts can actually contribute to us even feeling even more depressed. So it's important to be able to target some of these unhelpful thoughts and beliefs and maybe replace them with some more adaptive ones. Like, yes, it's certainly harder. I'm not going to be able to go outside and play basketball all the time. But what I can do is maybe still be able to cozy up at home next to my partner, with a warm mug and, a nice little blanket, and we can watch a fun, show like Home Alone, as well as I can kind of go online and spend time with my friends. And, maybe we can go skiing, maybe we can go skating. All those things are still possible. So being able to kind of replace some of those unhelpful maladaptive thoughts with ones grounded in reality. And finally, from a more acceptance perspective, it is helpful for us sometimes to go say, yeah, like, you know what? Today is kind of like a low energy day. It makes sense that with less sun, that's colder, that I might sometimes feel a little bit lower. And being able to say, and that's okay. Because we don't want to necessarily add fire to the fuel by saying, oh my gosh, like now, this is going to be like before, I'm going to feel terrible. As you can imagine, this almost adds suffering on top of the pain that's already there. We're almost adding our own judgments and interpretations and our own negative valence on something that is inherently not the best feeling. So being able to say, you know what, like today is a low energy day. I'm not going to feel the best, but I can make the most out of what today can be. Maybe treat myself to something, maybe give myself a little bit of time and space to read the book that I haven't had a chance to do. All those things can be helpful to mitigate the impact that these low energy days have on your lives and your overall mood. So hopefully this video was helpful for you to get ready for some of the colder, darker nights ahead. As Ned Stark once said, winter is coming, but you're going to be prepared for it. Thanks for watching as always. Take good care for now. Bye-bye.